we have received directions from the AYUSH department, Government of India, that Ayurveda, homeopathy, Unani, Siddha, and even Sovarikpa are all very useful systems of medicine that we have, which can help in maintaining the good immunity of our population and seeing that these general population will not get the disease. So it is to boost up the general immunity of the general population. The experts are going to give us inputs. Kindly bear with us for about an hour or an hour and a half. At the end of that, there will be question answer session. You could throw your questions either directly or through the chat box, and all your questions will be answered. And such programs will also be conducted and it made available on YouTube. Such of those who have not been able to register today and log on, they can download the YouTube and then go through the whole program and again ask us questions. So we are there to answer that and clear all your doubts. So this is the whole program. I take this opportunity to thank all the speakers who have come here today to enlighten us. So kindly, I request the first speaker come over here and talk about epidemiology and clinical features of the new disease all of us are encountering with. Thank you so much.
Measures for COVID patients. That is the first one. Second one is staying in the same close environment of COVID patients, which includes workplace, classroom, household, or gathering. The third part is traveling together in a close proximity, that is 1 meter distance with a symptomatic person who later tested positive for COVID. These are the definitions of the contact. Now we have two types of contact. One is high risk contact and second one is low risk contact. High risk contact, I'll be telling about high risk contacts now. High risk contacts are the persons who touch the body fluids of the patients like respiratory tract secretions, blood, vomit, saliva, urine and feces. And the second one is add a direct physical contact with the body of a person, with the body of a patient, including physical examination without personal protective equipments. Then the person touched or clean the linens, clothes or dishes of the patient. It could be healthcare worker, group D workers, or sometimes it could be the maid in the house. Then the person lives in the same household as the patient. Then anyone who is in the close proximity with the confirmed case without precautions, that is within the distance of 3 feet. Then passenger in close, that is any traveler, passenger in close proximity, that is within 3 feet of a convenience, with a symptomatic person who later tested positive for COVID for more than 6 hours. So these are the high risk types of contact. Coming to the low risk contact, type is the person who shares the same space like schools, worked in the same school, similar, and not having high risk exposure to confirmed or suspect case of COVID. And another thing is a low risk person is traveled in the same environment like bus, train, flight, or any mode of transit, but having a high risk exposure. These are the low risk type of contacts. Coming to the surveillance part, surveillance period is 28 days, that is for 14 days of quarantine at home. And next 14 days it is for self-reporting. 14 plus 14, 28 days is the total surveillance period. There are other modes like testing, sample and treatment, which should be taken up by the next speaker. Then key consideration for contact tracing is a positive case may have contacts in the multiple districts. Whenever a case is reported in the district, it becomes a responsibility of the district health authorities to track all the contacts located in the particular district, and later this will be reported to the state. So if in case of any high risk contact found in the particular district or the state, the sampling will be taken out by the district or state authorities along with the home or hospital quarantine thing, and later sampling to be carried out strictly according as per the guidelines, which I'll explain a little bit in next slide. This is about home quarantine isolation, that is airport arrivals, contact or confirmed cases. As any passenger who comes, that is every passenger arriving in India from COVID-19 affected country were followed up for 28 days irrespective of the symptoms. Now since the this year there is a ban on the air flights and all, these things are little bit not applicable now, but currently earlier it was practiced very precisely for 28 days irrespective of symptoms. Then followed by the concerned PHC, primary healthcare staff, and reporting to Taluka. So what they will do is whenever there is a contact of this kind, there is something called as rapid response team. They will conduct a daily personal visit. They will follow up for the patient for a specific duration. And also, suppose in any case, if they can't go, at least they'll follow it up with a telephonic thing. Next thing is personal details during this follow-up or during this tracking or tracing, symptomatic or asymptomatic, are always kept confidential. So there should not be any worries regarding this confidentiality. And finally, stamping on the dorsum of the left hand is put. Then taluka level compilation every day. That is, whenever there is such contacts would be there, the taluka level compilation would be done on every day. Later, they will report all these cases to district surveillance unit, and district prepares the line list of all the person who are suspected or who turns out to be positive. All those things would be prepared and reports to every day to the state surveillance unit. This is the picture. You can see very clearly there is a seal on the dorsum of the left hand. And the important thing is there is a date also which is mentioned. Then coming to the contact tracing, that is identifying the contacts of the infected person and recording them. Name, contact, and demographic information would be sought. Then data first and last exposure or date of contact with a confirmed or probable case is taken. Then date of onset with fever or respiratory symptoms developed. These are some data which would be collected from the person. The common source and the type of contact with suspected or confirmed case later is properly and thoroughly documented. Because you never know, contact can turn out to be positive later, earlier. So that's the reason proper document is done for all the contacts. Next one is what are the safety precautions which should be taken up by the health staff for contact tracing. That is always maintain 1 meter distance from the contact. Mask should always be worn by the contact tracing team. Provide personal protective, they should wear the personal protective equipment measures as per the requirement. At least mask, gloves, and some other personal protective equipments are required for the health staff. Then they should maintain the infection control, prevention and control measures, and also proper hand washing. These are some of the safety precautions that are currently taken up by our health staff for contact tracing. So this is one picture which is showing what happens if the case is identified in the community. Whenever the case is identified in the community, I'm talking the cases are identified in the community now. So identify the contact. These contacts would be monitored for 14 days from the time of exposure to case. If there is no symptoms, then monitoring will stop. Suppose if there is suppose during this period the contact develop a symptom, then they will identify their contacts and they will be monitored for 14 days. So symptomatic person contacts also would be contacted later. So and this symptomatic person would be isolated and he will be tested, treated depending upon the test results of those things. Next, if the case is identified in the health community, earlier I told it was in the community, now I am telling about case in the healthcare facility. What happens here? So a case in the hospital, again identify the contact, same thing, monitor for 14 days, then treat all the healthcare workers and the patient contact, close contact of the patient regarding of the development of symptoms, and they after the end of the 14 days again they will be tested. If they are positive, they will be treated, or else they will be those samples would be taken up, and if they turn out to be negative, those procedures would be stopped out. And again, same thing. Suppose if any of the contact turns out to be symptoms, same procedure, whatever I told earlier would be followed up. The symptomatic contact would be, their contacted would be traced in the field by the rapid response team. And the symptomatic person again would be tested, and depending upon the results, depending upon the positivity or negativity, for the protocols will be taken up. Then coming to the cluster containment strategy, what are the scenarios? We have 4 different scenarios. One is travel related cases reported in India. Second one is local transmission of COVID-19, that is single cluster. Whenever there is a single cases present in the single clusters, what needs to be done? And the third one is large outbreak of COVID disease. That means to say that diseases will have a multiple clusters in the locality. The fourth one is India becomes endemic for COVID-19. So IDSP, that is Integrated Disease Surveillance Project, for Government of India and Government of Karnataka will be involved in community surveillance in all the above mentioned scenarios. So it is the responsibility of IDSP project to report and do the contact tracing and do all the other activities with related to community surveillance. The containment zone will be defined based on the number of index case. That is the first case which is seen in that cluster, which will be designated epicenter. Whenever there is an index case, the designated epicenter would be found, and later geographical distribution of cases epicenter would be studied. Then local administrative boundaries of the urban cities and sound would be marked out, and other what are the necessity measures are required would be taken up for this containment zone. A scenario based approach would be taken up in this case while deciding the perimeter of containment zone. Coming to the containment zone, the decision of the perimeter of the containment zone is to be guided. There is some picture probably in the next slide, and you'll be knowing better about that when I project that picture. Implement of perimeter control, all those things is a administrative responsibility. As I told you, rapid response teams will be taken up on those things. Next slide, please. Next slide. This is a picture where you can see the red dots followed by the yellow, this thing and all. So yellow dots, yellow is the picture which is a containment zone, and followed, covering that containment zone is the buffer zone. In other color, a buffer zone is an area around the containment zone where the new cases mostly occur. So whenever these cases seen, that's why we do something called as buffering zone with related to, they will mark an area with related to 3 kilometers or 5 kilometers depending upon the severity of the disease, and later this buffer zone would be sealed and other activities would be taken up in the buffer zone. There will not be any perimeter control for the buffer zone. As I told you, it depends on various measures. What are the administrative measures with related to perimeter area during the containment? Refrain from leaving their houses and moving around the containment zone for at least 14 days. Then the people should not participate in any events, even in indoor venues also, whenever there is a fever or respiratory symptoms are detected. Then employers, actually they should cooperate for leaves and absence without written diagnosis. Then enhanced entry screening for all travelers from the containment zone, involvement of all the concerned department like health, police and various other departments. So these are some of the information which has been given. 104 is RASAYANA, which is a call centers, and many people are accessing whenever there is some doubts, and this is the place where people can call. There is also helpline numbers like 08046848600. There is another helpline number 08066692000. There are also websites, that's karnataka.karnataka.gov.in. The information would be provided in the Karnataka. If you want, you can log in and get all the information. And there is also Arogya Setu app, which is there, so people can access all the information with the usage of Arogya Setu app. There are other reliable websites like Ministry of Health and Family Welfare website. There is also websites of the WHO where you can see the information with related to global. There is also a Twitter handle at DHHFWK and MHFW India, PAB India. And some of the information would be provided on the activities, what are the with related to training, other things could be provided on the Facebook page of the Vice Chancellor Sir of the Rajiv Gandhi University also. So these are the references. Thank you very much. I thank VC Sir for providing me the opportunity to take the decision.
So kindly, I request Dr. Shashibhushan to come over here.
Good afternoon, everybody. At the outset, I once again thank Dr. Sachinanda, Honorable Vice Chancellor, Rajiv Gandhi University, for giving me this opportunity to speak, to highlight certain things on clinical features and management of COVID-19. What we are doing in Victoria, I just want to highlight, and what is clinical features you come across. I'll be dealing with clinical features, clinical symptoms, how to investigate, and what treatment from the medical point of view. So clinical features, as most of you know, what are the clinical features of, you come across the common symptoms are fever, fatigue. They can come with dry cough, anorexia, myalgia, all symptoms. They can come with any symptoms, whether it is related to GI, even conjunctiva, eye problems, neurological issues. Of late, we are reading through a lot of literatures which shows that they can present to you with any organ-related issues. There are no specific clinical features that yet reliably distinguish from COVID-19 or from with any other viral infections. Certain tricky situation, what you should know is what we have come across through literature is in a study in Bangkok, they found out that the patient coming with fever presented with only skin rashes and petechiae with a platelet count initially was diagnosed as dengue, but that turned out to be COVID-19 infection. In another series in Italy, about 20.5% developed skin manifestation like rashes, urticaria, and itching, plus or minus, and one case with chickenpox-like lesion. So this, you need to keep these things in mind and suspect all patients who come to us COVID-19 as of present situation. So as per the Chinese Center for Disease Control, the incidence of clinical manifestation has been divided into mild, severe, and critical. So in this, they made the severity is of mild is about 81%. So severe case is about 14%. Critical is about 3 to 4%. So most of them, what we have to take care of is the critical patients who come to us. So that's the percentage is very less, and compared to mild. Mild usually will be asymptomatic or with mild symptoms. As per the guidelines from the Ministry of Health keeps updating every now and then. So this is what there's a revised guidelines as on 31st March stating that how the disease classification has been done. It can be mild, moderate, severe, or very critical. So as you know that they can come, they can present with uncomplicated illness like simple fever, cough, sore throat, and you need to be careful again, especially in the elderly with immunocompromised, may present with atypical symptoms. Whereas in case of mild, the patient's signs and symptoms may be suggestive of pneumonia, but they can be clinically stable. So usually what happens especially in COVID-19 is hypoxia is more common. Hypoxemia will be disproportionate to the clinical symptoms. So that is one characteristic feature of COVID-19. So in case of severe, most of you know that severe pneumonia or severe infection, usually the patient will come with increased respiratory rate more than 30 per minute, and he will be in respiratory distress and oxygen saturation of less than 90 in room air. Acute respiratory distress, the patient as these are the patient whom get into the hospital and their saturation levels, what we call as PaO2 by FiO2 is less than 100 millimeters. That is severe ARDS. It can be mild, they can come as mild, moderate, and severe ARDS depending upon our ABG levels. So you need to keep this in mind. So they can also present with sepsis and septic shock. I'll not deal more on these things, just to highlight what it is. So I'm just telling about what is in the Government of India guidelines. So when a patient with COVID-19 comes, what investigations you need to order for? You should know. At your level, you should know what investigations are required. Usually we try to get a routine, before we get the investigation, we need to confirm a case of COVID-19, whether it is through confirmation is done through RT-PCR. It's a swab test, throat swab or a nasal swab. Ideally what we are doing is we are trying to get both nasal and throat swab, but endotracheal secretion and bronchoalveolar is not done. It is only on the books, and if you do this, it's at high risk. The doctor or person who is performing will have high risk of he himself getting infected. So of late, the next in line, what another probably a week's time, we'll be starting this rapid antibody test, which can detect IgM and IgG antibodies. So this will help basically whether the patient is infected with COVID. That's what it is going to tell us. Once a patient comes with suspected case of COVID-19, So what are the indications? When do you want to do a swab test, whether it is a throat swab or a nasal swab? All symptomatic individuals who have undertaken international travel in the last 14 days. This will hold good for another probably this month, and April 30 is what we are looking at, keeping in mind if they have a history of contact, a primary contact with an international patient. So this will continue till this month. Probably that's after next month onwards. I don't think so. This will come into picture. So all primary contacts of confirmed cases, whether he is symptomatic, you need to test immediately. If he is asymptomatic, usually we quarantine him and get a test done on 15th and 14th day. So to check whether he is positive or not. So all symptomatic healthcare workers needs to be tested. Patient, again, hospitalized patient who are suspected case of COVID, presented with severe acute respiratory illness, so needs a swab test to be done. And asymptomatic direct or high risk contact of a confirmed case should be tested once between day 5 and 14 of his contact. So in hotspots clusters, as per the Ministry of Health, in large migration gatherings and evacuation centers, these patients, these are two new terminologies called as influenza-like illness, where the patient can have fever, cough, sore throat, runny nose. Within 7 days of illness, we need to get an RT-PCR done. If it is later than 7 days, the antibody test, which is going to come up shortly, will be started off. So what are the other blood investigations? Once if a confirmed case of COVID positive comes, you admit him in a COVID positive ward and certain blood investigations are done. Usually routine blood investigations are done like TCDC and routine blood investigation. And what is characteristics, what you are finding in a routine blood investigation is the total count may be normal, may be increased or may be reduced. The characteristic feature of a COVID-19 is lymphopenia. The lymphocytes counts less than 10. So you can clinically say this is a COVID patient. So this is one, our experience, what we are able to make out on blood investigations. Other markers like serum ferritin, D dimers, CRP, LDH and procalcitonins. Other specific investigations like renal function, liver function, ECG, echo. If there is a facility to get an echo done, you can get serum electrolytes. These are all in the ICU setup. These tests can be done. Routinely, we are getting a chest X-ray in our unit, but not a CT thorax. So I don't think so. CT findings may be relevant for you people. I'll just skip this slide. Coming to the guidelines in management of COVID-19 as per Government of India, Ministry of Health and Family Welfare. So as per the available data in India suggests that 70%, what the Chinese data showed 80% exhibited mild, but our data is showing 70% of the cases whether either exhibit mild or very mild symptoms. So these may not require admission to COVID-19 blocks or dedicated hospital. To ensure that available hospital bed capacity is used only for moderate to severe case of COVID-19, the standard operating this thing has been made, and SOP specified hereafter will specify that different type of facilities to set up in various categories of COVID-19. This was released today by VC sir, and for all district hospitals, all these facilities will be henceforth start off. So what is called as the dedicated centers will be like COVID care centers. This shall offer care only for cases that have been clinically assigned as mild or very mild cases or COVID suspect cases. So clinical criteria should be case presenting with fever or upper respiratory tract illness like influenza-like illness. Exclusive will go to COVID care centers. So we have something called as dedicated COVID healthcare centers. Here the hospital shall cater for all cases that have been clinically assigned as moderate. So here respiratory rate should be around 50 to 30 and SpO2 between 90 to 40. Here a monitoring is required. So next will be a dedicated COVID hospital. Here the services offered will be patient with severe pneumonia whose respiratory rate is more than 30 or in ARDS or septic shock. All these three hospitals henceforth will be started very shortly. And this thing. At the AYUSH level, what I would request is you will be screening most of the patients. So where you have to know these things, and accordingly you have to shift the patients depending upon the condition of the whether he falls to mild or very mild or moderate or severe. Slide depicts the same where you need to admit depending upon the severity. Regarding the treatment plan, I would not go into depth of the treatment plan. I'll just specify there is no specific treatment for COVID-19 disease or vaccines as of now. It's only supportive therapy as advised. You need to give symptomatic treatment provided depending upon the patient clinical status. You give oxygen, peripheral antimicrobials, IV fluids, inotropic support in case of shock, and mechanical ventilation. In a patient is in acute respiratory distress syndrome. In Victoria Hospital, we have categorized the patients based on the symptoms, signs, and vitals. However, based on the available information, the following drugs may be considered depending upon the situation where these drugs can be used. We are using both hydroxychloroquine and azithromycin. These drugs should be administered under close medical supervision with monitoring for side effects, including QTC intervals. So under monitoring only, this has to be administered when you are giving in a combination. So these guidelines are based on currently available information and would be reviewed time to time as new evidence keeps emerging. So zone wise, we have made into 4 zones. Group A is green zone, that is confirmed positive patient. Patient may be asymptomatic with or without comorbidity. We have a separate ward for these patients. The group B is yellow zone, is a confirmed positive COVID patient, symptomatic with or without comorbidities like diabetes, hypertension, ISDs. So the group C is the orange zone, where you have confirmed, it's a confirmed case with symptomatic whose respiratory rate is more than 24 per minute, SpO2 of less than 90% in room air, who requires oxygen and support. The red zone is the patient who is in respiratory failure requiring ventilation or hypotension requiring inotropes on support. So coming to hydroxychloroquine prophylaxis, this is again recommended by Ministry of Health on 22nd of March. What it says is asymptomatic healthcare workers involved in a care of suspected or confirmed cases should be given hydroxychloroquine prophylaxis. That is 400 milligram on day 1, followed by 400 milligram weekly for 7 days to be taken with meals. Or the second one more category where this prophylaxis is given is asymptomatic household contacts of a laboratory confirmed cases. Here you are giving 400 BD on 1 day, followed by 400 weekly for 3 weeks. So once a patient is symptomatically better, when do you want to discharge a patient? So ideally, the discharge criteria is when 2 swab samples on the 14th and 15th day, 2 consecutive days, his nasopharyngeal or oropharyngeal samples should be negative. That is the criteria. If you are in an ICU, there should be some radiological resolution. So that is the major criteria, and he is advised supervised quarantine for another 28 days. So this is the criteria for a discharge. And symptomatic medication you can give for a patient who gets discharged. Thank you.
Thank you, Dr. Shishibhushan. We move on to the next speaker, Dr. Anand Katti, Associate Professor at Government Ayurvedic Medical College. He will be speaking to us on role of AYUSH doctors in COVID-19. The role of AYUSH doctors has been very much emphasized by our Prime Minister today in his speech, and he has assigned a specific job to AYUSH department, and I think that is what Anand Katti is going to touch upon now. Thank you so much.
Thank you, Honorable BC sir. Hello, dear doctors. After 2 sessions, my duty is to deal with the role of AYUSH doctors in COVID-19. I am Dr. Anand Katti, Associate Professor in Government Ayurveda Medical College. As far as the AYUSH, the presentation purpose is concerned, the objectives are clearly stated as it will be a session where you will be sensitized about your role as AYUSH doctors in COVID-19, and you'll be able to understand and appreciate the role of AYUSH doctors in COVID-19. And maybe it is the time we don't know, we can't predict when we are made to work actively, and the participants will be ready to act as soon as the need arises. These are the specific objectives for this presentation. So as far as the human resource management guidelines given by the Ministry of AYUSH, Government of India is concerned, we have assigned certain role as AYUSH doctors, and our roles come in in these areas. I want you to look at this slide which says field surveillance. So field surveillance is the where young personnel are preferred, which is designated for AYUSH students to take up the task of doing the field surveillance. And field supervision, where experience is required, so AYUSH doctors are required. So when I say AYUSH students, it's effectively the undergraduate students of Ayurveda AYUSH courses. And when I say AYUSH doctors, these include the internees, the PG scholars, the practitioners, the registered practitioners, both the public, the private practitioners, as well as the government practitioners, including the teaching faculty in various AYUSH colleges. So we may be asked to do the duty at an isolation facility. So isolation facility is also a task that need to be given attention by the AYUSH practitioners, AYUSH doctors. Infection prevention and control is the lookout of every doctors. Therefore, it is the lookout of AYUSH doctors also. Medical care and nursing care that has to be imparted in non-COVID areas is also the responsibility of AYUSH doctors. So therefore, so basically, as has been provided in the previous slide, we have these mandates in our hand. That is the field supervision, infection prevention and control, isolation facilities, medical care, nursing care in non-COVID areas. And since we have to deal the first part through of surveillance, we need to give the training to AYUSH students also. So in fact, I have to remember something that happened very recently. The Government of India, Ministry of Health and Family Welfare, in association with Ministry of AYUSH and the Central Council of Indian Medicine, conducted a master training program, an extensive training program for included 4 sessions, ran for 4 hours. Through the online training was done, where certain master trainers were created in AYUSH colleges, and the master trainers were given the mandate of teaching all other teachers, the students, including the postgraduate and the undergraduate students. So in that background, that one step has already been done. 4th of this month was the date on which it was conducted, and they were instructed to report back with all the list of trainees by the 10th, which most of the colleges have been are done. So in that connection itself, this is a venture that Rajiv Gandhi University is conducting, where that goes to the organized sector of AYUSH colleges, whereas we have so many AYUSH practitioners who are registered practitioners but may not be exposed to much training. So this training serves the purpose for them also. So as far as the role of the AYUSH students or AYUSH community is concerned, the AYUSH students are basically meant to work under the AYUSH doctors. They serve as a support to AYUSH doctors. They serve as a support to the supervisors or the lady health officers. And they have got the major assigned duties. First one happens to be the field surveillance. How the surveillance need to be done has been already enunciated. So as far as field surveillance is concerned, an AYUSH student may be required to go to house surveillance. He may be asked to identify the high-risk groups. High-risk groups are the groups who are vulnerable to this infection. That is the elderly population. That is the population who are suffering from some underlying long-standing diseases like diabetes or cancers, where we can find the immunocompromised conditions, the diseases of kidney, the lungs, the respiratory issues. So all they become the high risk groups, including the pregnancy, though there isn't any evidence that pregnancy is a risk factor, but still there is it is considered as a high risk group. So identification of the high risk group is the duty of the AYUSH students. And whenever the case is detected, probable cases, whenever they are detected, it is the duty of AYUSH students to report it quickly. And he has also a duty of communicating rather community awareness through interpersonal communication. So social distancing has already been emphasized. So a social distancing has to be re-emphasized in the community, and many of the students will be working in group, for example 3-member, 4-member. So for them also it is very imperative that they maintain sufficient distance, and so that it becomes easy for them to communicate to the society that social distancing is very much required. So 1 meter distance is what is mentioned. And the second one is hand hygiene. Hand hygiene, okay, frequent hand wash is very much essential, and the ministry has given a guidelines for how to do the hand washing. So hand washing should be done in such a way that every nook and corner of the hand is washed thoroughly, and hand washing every 2 hours, or using a soap or a hand sanitizer, which is an alcohol based hand rub. Respiratory hygiene is another thing, so which says whenever the symptoms of sneezes and coughs, we should cover the mouth. And the mouth is covered by either a tissue paper. Tissue paper, if it is covered, has to be disposed of in rather disinfectant solution, or an alcoholic solution or bleach solution. And okay, that's you have to cover whenever we sneeze. And there are so many myths and misconceptions that are prevailing in the society, so regarding the spread, and we cannot predict the kind of myth that we face. A proper understanding of these will help us address all the myth and misconception, which is also a duty of an AYUSH student doing in the field surveillance. So personal safety and precautions of the people, the student in the surveillance is also very much essential. So when moving around the community, a student or the surveillance team should make a social distancing very compulsory, should practice the hand hygiene, the respiratory hygiene very meticulously, and should never touch the mouth, nose, and eye with the hands. And immediately after reaching home also, there are some practices that a surveillance team should do, and they happen to be immediately, if you're obviously, since you're a health worker, you will be wearing a mask. Mask has to be disposed of. Mask has to be disposed of in a bleach solution, and then disposed in a sealed container. Then you have to remove all the things that you carried. Maybe it is a mobile or a headphone or a laptop or belt. They all need to be rubbed with a sanitizer, with an alcohol based rub. Hand has to be washed, and preferably your clothing has to be immediately given for a wash, taken for a wash. So this is the duty of a surveillance, and these duties are to be effectively done by AYUSH students, and it is the lookout of AYUSH teachers and AYUSH doctors to impart these trainings. And whenever any suspect or anything is reported, they observed, then they have to report it back to the system. As far as reporting is concerned, we have a chain which tells us how the reporting machinery works. So AYUSH students are basically required to work in the field, and therefore they have to report to the immediate next one. So immediate next one is someone who has given him a master training, or someone who is in the teaching, who is a teacher, or someone who is the head of the institution, someone an AYUSH doctor under whom this fellow is working, or the principal of AYUSH colleges. And they in turn will pass on the information to the district AYUSH medical officer, or the district surveillance officer, or even the district health officer, and which ultimately will be shared to the deputy commissioner of the district. Now, as far as the duty of AYUSH doctors is concerned, one important duty is the field supervision. So field supervision requires some basic understanding of what happens with a suspect is to be made known. Before we start really looking into what are the duties at the level of field supervision, let's look into the life of a suspect. A suspect which is primarily picked up by a surveillance officer at the ground level will be shifted to a COVID screening hospital, and where he will be subjected for COVID screening. So since the protocols are getting changed quite repeatedly, so ICMR gives a certain protocol on which the primary suspect, the suspect who is found to be a suspect at the surveillance level, may not turn out to be a suspect. So after the screening, there are two possibilities. He may be a suspect, he may not be a suspect. So in case if he is not suspect, he will be sent for quarantine. And if he turn out to be a suspect, then his sample will be collected and he will be sent for an isolation till his result comes. So the sample collection result will be obtained before it was 3 days. Now the next day itself we are getting the report. So the reports are two possibilities. It can be a positive one, it can be a negative one. So if it is positive, it will be shifted to a COVID designated hospital. If it is negative, then there are two possibilities. So the two possibilities, one is without the symptoms, if he is negative, then he has to be sent for home quarantine. And if he has any symptoms, then he has to be isolated in hospital. So with this background, we look into what are the duties, the role and responsibilities of an AYUSH doctor. So field supervision will invariably start with identifying the suspect. So how to differentiate between a COVID and non-COVID suspect has already been dealt. So anyone who is having the symptoms along with some sort of history and along with some sort of history of travel as well as the primary contact, then he will be taken as suspect. So in such case, he need to be shifted to the screening centers. In screening center, during the shifting also, some safe practices are to be practiced. So we need to call an ambulance service. Not 8 is the ambulance service provider in Karnataka. So we need to bring the ambulance and make sure that the patient is shifted. And during the shifted, since it is a highly contagious disease, so only patient will be shifted unless until it's a pediatric age group or a bedridden patient. So who may require one assistant. So during the shifting also, the sanitization practices are to be kept intact. So we have to sanitize every part of the ambulance where the person suspect comes in contact before and after. So this requires a field supervision duty of AYUSH doctor to re-emphasize self practices. So at that point of time also, the community is there, the community health practices are to be emphasized by the AYUSH doctor. Then once it has been already said that he may be, there are quite a few chances that he may be turned out to be a quarantine. So in case of quarantine, there are certain practices that need to be given, that need to be instructed to the quarantine himself. The suspect has to remain for a quarantine for a particular duration. So earlier the duration was for 14 days plus 6 days in some cases. Now since yesterday the quarantine period has been extended up to 28 days. So during the quarantine period, the suspect has to stay isolated in his room only. It is ideally mentioned that he has to remain isolated in a well-ventilated room where he is probably asked not to share any of his belongings with any other. So it is better to have a bathroom, toilet designated for him only. So and he should not come in contact with the others, and he even in some situations that demands him to come in contact, he has to maintain a sufficient distance, he has to use a mask, and he should never be allowed to come in contact with any elderly persons. So that is the instruction that need to be given to a quarantine. And the quarantine family practices are also very essential. An AYUSH COVID doctor need to give the information, need to educate the family about the mode of spread, and therefore the family also need to be educated, particularly the elderly in the family should not come in contact with the suspect. The food, etc. need to be given in such a way that there is no contact being established with the person in quarantine. So since the staying in quarantine is a challenging task for the suspect also, we have seen some of the incidences where there is violation of quarantine phase. So therefore, in Bangalore especially, there are home quarantine enforcement squad being constituted. So an AYUSH doctor, particularly the government AYUSH doctors, are right now presently appointed as in a team which comprises about some police staff also. So what happens in this case is usually a complaint comes when a quarantine walks or comes out of the home, walks in a street or comes out from his apartment itself. The someone who has seen him will complain it on 104, and thereafter the home quarantine force and enforcement squad is intimated that there is such and such person who is violating. So immediately the home quarantine enforcement squad along with the local police will rush to the place, and they will talk to the suspect. And if the case is very genuine, if he is alone and he has to has to come out for essential things, then there can be some humanitarian consideration and he may be instructed and go back for quarantine. But since it is a negligence, there is a chance that an FIR can also be booked against him for violation of the quarantine norms. So it is the duty of AYUSH COVID doctor to see that he is in quarantine. If the violation is there, then an FIR has to be registered. And after the FIR registration, so we need to again to call to an ambulance and shift the suspect to a mass quarantine center. right now in Bangalore city, there are certain areas which have been, certain hospitals which have been identified as mass quarantine centers. So to name few, there is some hospital in C.V. Raman Nagar, there is Akash Medical College itself is a mass quarantine center. So even the quarantine facility is taken up by some hotels or private organizations, etc. So based on where the geography of the suspect, based on the distance that is required to travel, based on the availability of the quarantine, the facilities at the hospital, we may need to shift the person from home quarantine to mass quarantine. That is the duty of an AYUSH COVID doctor. So again, mask usage is another thing which the AYUSH COVID doctor has to re-emphasize even to the society as well as for the doctors as well as the student. So mask, okay, ideally a healthcare worker has to use a 3-layered mask. So there are guidelines for which tells us how to use the mask also. I insist upon you to please visit the website of Ministry of Health, Government of India, where there are video clippings regarding how to use the mask, how to dispose the mask, everything are available. So the disposable masks are meant for very, very short use. So they should be changed after 8 hours only and when they get wet. And there was a period that said no, mask is not for common people, but since the spread is more, so the even communities, the common people can also use the homemade reusable masks, so which can be washed using in a bleach solution and used repeatedly. So another duty of an AYUSH COVID doctor happens to be the health advice to the elderly. So the elderly people are already set as the high risk group of people, and hence they need to be given some specific instruction not to come in contact with the suspect, instruction to maintain the social distancing. All health practices are to be practiced. Along with those, they are not, we should see that they don't skip any of their medication. They should eat healthy food and they should live a healthy life. Health practices, maybe a pranayama, maybe an exercise, etc. All those are to be advised by an AYUSH COVID doctor. So health advice to the elderly is another duty of AYUSH COVID doctor, and addressing myth and stigma. So obviously a suspect would have so many fears and will have so many questions, and you have to, as a doctor, AYUSH doctor, you have to do counseling effectively, and you have to teach and educate all these things to the patient and the surroundings and the neighbors and the society itself. So as far as field supervision is concerned, these are the important tasks that an AYUSH doctor should perform. So as I was talking, a suspect, if he is really suspect, would be taken for isolation. So in isolation facilities also there is a role for AYUSH doctors. A suspect is temporarily kept in a buffer zone. So this is not the buffer zone that earlier speaker was talking about. So positive cases are sent to the COVID hospital, the negative cases with symptoms require management. So patients usually will be kept in an isolated single rooms. So AYUSH doctor may be asked to monitor the isolation center in association with the other staff, other doctors and paramedical staff. And AYUSH doctor may be asked to suggest an intervention based on clinical condition if alternative AYUSH treatment is required. So for example, in case of the respiratory problem, a breath exercise, a pranayama may be required, which an AYUSH doctor can take care of, and proven drugs, proven AYUSH treatment can be can be given in association with the modern medical doctor there. And the another role of AYUSH doctor can be to suggest safe and non-controversial AYUSH immune boosters, which is a session after this session only. So these are the responsibilities of AYUSH doctor as far as isolation facilities are concerned. Now the next role of AYUSH doctor is prevention of infection and controlling it. So regarding this itself, particularly in Bangalore city, fever clinics are established in elsewhere. This is looked after at the primary health centers. So the doctors and postgraduate students are posted there. Even in Bangalore, within the BBMP limits, the AYUSH doctors are posted for fever clinics, and therefore there is a role for AYUSH doctors in fever clinics also, where they will work in association with a modern medical doctor. And regarding the community hygiene, it has to be re-emphasized at every level regarding the hand hygiene, the social distancing, the safe handling of patient care, even the mask and the personal protective equipment kit has to be disposed, and it has to be disposed whenever a necessity comes. We have to wear it, and it has to be disposed in yellow cover, which is kept at the disposal center of all the screening centers and even the hospitals. And patient waste disposal is also need to be meticulously disposed, and the role of AYUSH doctor is to supervise and see that all these are done effectively. And as I was talking about this, as of now, all these roles are assigned only to government AYUSH doctors as of now in the Bangalore city. And the situation may need where every other AYUSH doctor may be required to do this task at any stage. We don't hope it, but since the spread is if the spread is rampant, then everyone may be required to do this work. So this is the role of AYUSH doctor as far as infection prevention and control is concerned. The next duty is in non-COVID areas, the medical care and nursing care in non-COVID areas. So this is regarding the information, education, and communication material which is provided in the website itself. So it is the duty of AYUSH doctor to see that this information is disseminated to the community at large. So there are pamphlets, handouts that are available on the website. So the surveillance team will collect it and use it, and we have to see that these are properly distributed and put in use. And there is another thing that an AYUSH doctor can do, and which comes in the context of telemedicine practice. So telemedicine practice guidelines 2020 for Ayurveda, Siddha, Unani, and Homeopathy guidelines have been issued by the apex bodies of Central Council of Indian Medicine and Central Council of Homeopathy. So which we have to make use. So through the telemedicine, we have to contact the patient. The patient has to come in contact with the doctor and thereafter get the consultation done. So the Telemedicine Society of India Karnataka chapter is conducting a series of webinars on this, how to go ahead with the telemedicine practices. I insist all of you to get yourself trained in these webinars also. One of the webinar will be tomorrow itself. And the link is being circulated widely in most of the social medias. And Karnataka government, Directorate of AYUSH has already published the list of doctors to be consulted as far as telemedicine is concerned. So telemedicine consultant doctors list is available on the website. So if you are in a particular area, whom you should contact, that contact doctor name along with the phone number is available. So it should be made use of. So that's as far as the medical care and nursing care in non-COVID areas that an AYUSH doctor can perform. So these are the inputs as far as this presentation is concerned, and much of the information has been gathered from the websites of Ministry of Health and Family Welfare, Government of India website, AYUSH Directorate, Government of Karnataka website, and even the Rajiv Gandhi University website. For more information, you can certainly go on these websites. I would like to conclude by thanking the Honorable Vice Chancellor of RGHS for this wonderful initiation, at the same time inviting me for this presentation, my mentor or principal, and all of you for having a patient listening. Dr. Yedali sir also, thank you very much.
Now we move to the last topic of today's seminar, role of AYUSH in boosting general immunity. We have three speakers. One is Dr. Bairesh. He is principal of Adi Chunchanagiri Ayurveda Medical College from Bangalore. Next is Dr. Umashankar S. He is principal of Padma Shri College of Public Health, Bangalore. He is going to speak on homeopathy. And lastly, Dr. Salma Bano, Professor, Government Unani Medical College, Bangalore. So it is first over to Dr. Bairesh. Thank you.
Thank you, sir. Jai Shri Gurudev. Dear friends, today I'll be speaking about role of Ayurveda and Yoga in boosting general immunity. Being an Ayurveda practitioner, the moment we speak about immunity, we think about Vyadikshamatva. And we all agree, Vyadikshamatva is not got only by medicines. You just look at a case scenario here. You have a friend who gets up late in the morning and has his breakfast very late, somewhere around 10 o'clock. Immediately after breakfast, he has a bath. He spends his time watching TV or with any other sedentary habits, munching snacks. He has a late noon lunch, watching TV. Then he sleeps, he has his day sleeps, and gets up in the evening, goes for walk or exercise and has snacks. And again, because of the evening snacks, he has got a delayed dinner, again glued to his TV or mobile, and he sleeps late at night. Now, do you agree with me if I tell you that a person having such a daily routine takes some immunity booster that will improve his immunity? Probably not. So that is where whenever we speak about Vyadikshamatva, we also think about Rasayana, which can be Dravya Bhuta or Adravya Bhuta. Now we look into the Adravya Bhuta form because until and unless we correct the biological rhythm of this person, will not be able to boost his immunity. Dear friends, probably we'll have to go to the basics of Ayurveda, wherein we have learned the Dinacharya, which tells you when to get up, how to eat your food, when to eat your food, and what are the various measures to be followed whenever you're coughing, sneezing, the precautionary measures you'll have to take whenever you're going out of your house or when you're coming in. Or if you tell me that, okay, sir, I'll go follow Dinacharya throughout the year, will I be healthy? Will this boost my immunity? Probably not, because we have various Rutus and we need to adapt to the changing Rutu and follow the Rutucharya. We have hot seasons, cold seasons. What is said to be nectar in one season could be a poison in other season. So it is our bounded duty to follow the Rutucharya or the regimen that has been prescribed for that particular season. In particular season, we have been told that what is the amount of food to be consumed, what is the amount of exercise and sexual activity to be indulged in, all these things. So in spite of following a Rutucharya, there is something called as Rutusandhi. That is the period of transition of one season to the other, wherein in spite of your utmost care, you tend to fall prey to diseases or illness. So you'll have to take care of your Rutusandhi and adapt to the changing seasons. So, okay, you have your Dinacharya there, you have your Rutucharya. You say, okay, will I be healthy then? No, it again depends on your thought. See, we have your Dharaniya Vegas, that is certain habits which you need to suppress, like the fear, anger, and the jealousy. Whenever you suppress these elements, your mind will be relaxed. Whenever you have a healthy mind, that reflects in your health also. So that is how, by following your Dinacharya, Rutucharya, and Sadvrita, you'll be able to correct the biological rhythm, which will make you move towards a healthy individual. That is to say, if you have your good habits, that is a right time food and a healthy routine, a good behavior towards yourself and to the community, good thoughts, that is with the habit of live and let live, what happens when you do all these things? Friends, you agree, whenever your mind, your physical self, your mental self and emotional self, it is harmonized, then that will improve the bioavailability of the substances that you consume. That is to say, the rasa dhatu is improved and thereby it improves the other dhatus. Ultimately, the sarva dhatu sara, ojas, is improved. You agree with me when I say ojas is bala, that is what is going to boost your immunity, which will act as an immune booster, which is told as achara rasayana in Ayurveda. And friends, you also agree if I tell, if you follow a healthy regimen, you will not require any additional immune boosters. On the other hand, if your daily routine is not healthy, even the best immune boosters will not be able to help you. Now we have various scholars who have done brainstorming and arrived at a list of Ayurveda drugs which are going to help to boost your immunity. We'll try to look into the logic behind such selection. Now the present Ritu, what we are in, is Vasanta Ritu or towards the end of Vasanta Ritu. We all know during Vasanta Ritu there is Kapha Prakopa. Since Vasanta Ritu falls in the Adana Kala, the bala of an individual diminishes day by day. So considering the Vasanta Ritu, the Kapha Prakopa Kala and the Rogi Bala, if you aim at selecting a drug, definitely yes, you will be selecting Shunti Maricha Pippali, which is together called as Trikatu. The other drugs that have been identified to boost your immunity include Haridra, Lashuna, Nimba, Guduchi. Again, if you analyze these drugs, why only these drugs have been selected and not the other drugs, you understand that based on the Rutu and the Dosha that is predominant, the selected drugs have predominantly Katu, Tikta or Kashaya Rasa. They are Ushnavirya except for Nimba, and by Doshahara property, they are Kapha or Kaphavatahara. If you apply this logic, definitely I bet you come out with more number of drugs even your prepared medicines like your Chavanprash, Dashamula Haritaki Lehya and others. It is very easy once you follow this logic of selecting the drugs to boost your immunity. Now, some of the popular prescriptions that has been suggested by the Ministry of Health and Family Welfare include the practice of Pratimarshanasya with Tilataila, Narikela Taila or Grita. Being an Ayurvedic doctor, you know when to practice Pratimarshanasya, or doing Kavala or Gandusha, that is gargling using coconut oil. You can also use Bashpasveda with Pudina or Ajamoda, which will definitely help to improve the immunity of your respiratory system. There are other drugs which can be used internally along with a proper daily routine and regimen. You can take this Lavanga Churna with honey or drink boiled and cooled water as far as possible. Follow the traditional way of cooking. The traditional Indian way of cooking includes the use of spices like Haridra, Dhanyaka, Lashuna and Jeeraka. This will definitely improve the taste and also improve the bioavailability of the Ahara Rasa. You can also prepare decoction using a combination of Maricha, Shunti, Tvak, Tulasi and Draksha along with Guda and lemon. Or if you want to make it more simple, you can mix about half teaspoon of turmeric powder with 150 ml of hot milk and drink it daily twice in a day, which will definitely help you to improve your immunity. Next, we all agree not only food, even exercise is required to remain healthy. The moment we say exercise, we know about Vyayama that will delay the aging process and it will mitigate the ill effects of Viruddhahara. It improves your appetite and also helps in mitigating the disease. The moment I say Vyayama, majority of the people will tell, yes, I am doing yoga. Friends, remember, yoga is not only Vyayama, but it has got the Ashtanga part of it. That is Yama, Niyama, Asana, Pranayama, Pratyahara, Dharana, Dhyana and Samadhi. When these Ashtanga yogas are practiced in a diligent way, that will help to improve your internal harmony and peace. There are various asanas that has been prescribed to improve the immunity of a respiratory system. I'll discuss about some of the asanas here. You know, there is Ardha Chakrasana, Chakrasana, Natarajasana, Padahastasana, Vakrasana, Ushtrasana, Gomukasana, Matsyasana, Shalabhasana, Bhujangasana, Dhanurasana. Remember, these asanas should be practiced or done only under an yoga teacher guidance if you're doing it for the first time. Apart from yogasanas, we have various pranayama techniques, that is the Nadi Shodhana pranayama, Kapalabhati, Brahmari, Shitali and Chitakari pranayama followed by Yoga Nidra. We do have some bandhas like Uddiyana Bandha and Jalandhara Bandha. Regular practice of yogasana and pranayama that have been suggested here definitely will help you in improving your immunity of the respiratory system and help to mitigate the symptoms of the flu-like features. Nature always astonishes in various ways. Ayush practitioners know about the doctrine of signature. If you look at the structure of coronavirus, it has got a strong resemblance with the flower of Kadamba tree. Is nature trying to say something? To conclude, Nityam Itahara Vihara Sevi Samikshakari Visheshasu Saktaha Data Samaha Satyapara Kshamavan Aptopa Sevi Cha Bhavati Arogaha. Thank you, friends. Thank you, sir.
Thank you, Dr. Barish, for that introduction about boosting our immunity to protect ourselves from COVID infection and for that matter any respiratory infection as such. I would request Dr. Umashankar to give us an insight into the homeopathic aspects of boosting the immunity.
Thank you, sir. Good afternoon, friends. In the next 5 to 8 minutes, I'll be talking of role of homeopathy in boosting general immunity. So the learning objective would be, let's recall the concept of health, disease, and treatment in homeopathy. Discuss immunity and action of homeopathic medicine in building immunity or boosting immunity. recall some of the historical references or evidences in prevention of epidemic or pandemic disease by homeopathy, and discuss the role of homeopathy in prevention and control of COVID-19. This slide is specifically for because we have an heterogeneous audience, so those who do not know what is homeopathy. So homeopathy is a system of medical system that was developed in Germany by Dr. Samuel Hahnemann more than 200 years ago, based on 7 cardinal principles of homeopathy, which are law of similia, that is like cures like, law of simplex, law of minimum, and doctrine of drug proving, theory of chronic disease, theory of vital force, and doctrine of drug dynamization. So we believe what can cause similar disease can cure. What substance can cause, the substance which can cause some symptoms, if it is given to a person with a disease condition, the same substance can cure. Law of simplex and law of minimum, we are talking of we are giving a minimum dose and a single remedy for a person. So there are other principles, I'm not going to talk about that. Next we move on to what is the concept of health. In homeopathy we believe there is a harmonious flow of vital force. So health, a person who is healthy means there is a harmonious flow of vital force in body and mind which is responsible for the health. And when there is derangement in this vital force, there is a disease. So basically organism has a capacity to react to the stimuli, that is internal or external stimuli. Probably this is the vital force what they have been talking about. So when the vital force of the organism is deranged, we get the biodynamic influence by any agent, then we call it as a disease. Now how does the body's defense mechanism and what is the relationship with vital force? So defense mechanism is a very complex system inside our body which is created to protect for hostile effects, maybe internal or external environment. So there is a mechanism which comprised of reticuloendothelial system, sympathetic and parasympathetic nervous system, endocrine system and lymphatic system, mainly the defense mechanism or immune system, what we are talking about over here. Now, as we all know, most of us have learned that in our body we have 2 types of immunity, innate immunity and adaptive immunity. Both has cellular and humoral concept. Now, what is the role of homeopathy in immunity? So homeopathic medicines actually stimulate body's own defense mechanism to fight against the pathogen. There are enough evidences or research evidences in the past which has demonstrated that the basophils and mast cell showed that the homeopathic medicines in ultra diluted form can influence the degranulation of mast cell and basophil cell. Hence, that's helping to build immunity. So there are experiments, you can go through the research articles. This is not the only research article, there are several research articles which have proved that homeopathy has helped in building defense mechanism. This one example is like homeopathic drug like lung histamine and Apis mellifica actually helped in influencing degranulation of the mast cell and basophil cell. So hence it's improving the immunity. Now let's look at how homeopathy has helped in the past whenever epidemic or a pandemic situation has occurred. So there are well documented evidences where Samuel Hahnemann himself has documented few of the epidemics. So like for cure and prevention of scarlet fever during his time, Hahnemann used atropobelladonna in prevention and treatment of initial stage of epidemic in Germany in 1799. The remedy was chosen according to the genus Epidemicus, and this would change at every stage of the disease. So it's not that you select one remedy and then you go on continuously. Depending on the situation and how the disease is changing, and according to the geographic region and the place, because for example, the virus may mutate and change in every place, or they may change, the strain would be different. So based on that, what they are depicting the symptoms, we need to change the genus Epidemicus also. Now, what kind of a remedy we should select? For genus Epidemicus, it should be a remedy that is capable of quickly checking a disease in its onset and must be the best preventive at that given point of time. Now, the next example or the evidence what we can look at is how homeopathy has helped in epidemic or pandemic case, where Hahnemann himself has documented that in cause and prevention of Asiatic cholera. That was in 1831, there was a huge epidemic of Asiatic cholera in Germany. So he has described that we can use He has used camphora, cuprum metallicum, and veratrum album as a medicine for this homeopathic management and genus epidemicus. Again, he has specifically mentioned that it should be at every stage you have to recheck and change the medicine. And you should always prescribe an individualized way according to simillimum and symptoms at the stage of the disease for prevention of any of these epidemic diseases. We are always comparing COVID to Spanish flu. From everywhere we have been comparing that, and how homeopathy has helped in 100 years ago when the Spanish flu was there. In 1980, when Spanish flu pandemic infected more than 20% of the world population and killed about 30 million people. So at that time, they selected few remedies and they have used these remedies extensively to control the disease. Some of them are arsenicum album, bryonia alba, bacteria, eupatorium, gelsemium, and among others. According to that, at that time, genus epidemicus, they observed at different stages and at times and different places, they came out with these remedies. So there were other evidence, research evidences, which also proved that how in America, also the epidemic and pandemic was managed. The Spanish flu pandemic was managed using homeopathy. So in 1921, 26,000 cases treated with homeopathy in Ohio presented 1% mortality rate as against 28% in 25,000 cases with conventional treatment. Similarly, same was observed in Philadelphia also, where more than 26,000 cases were treated with homeopathy. So you can go through the research articles, and there are other research articles which are giving enough evidence how homeopathy has helped in such epidemic and pandemic situation. Now, as I said, these are some of the epidemics where you still, like in typhus, it was mortality rate in conventional method was 30%. When they took homeopathic treatment was 1.5%. Then yellow fever was like 15%. In 1850, it was 15%. When homeopathic treatment was taken, it was around 6%. So similarly like that. Here, it's not claim about anything, but it's just showing the evidence in the past that homeopathic medicines has helped in such epidemic or pandemic situations. Now coming to COVID and homeopathy, we observed the report from WHO China Joint Mission. They published an article after looking at more than 72,000 cases, where they found that the symptoms were fever. Majority of the patients of COVID-19 presented symptoms of fever, cough, fatigue, and cough with sputum, and shortness of breath, myalgia, sore throat, and etc. So when we look at all these symptoms and when it was repertorized, and most the top medicine or the remedy which comes is the arsenicum album, which covers almost all the rubrics when including the mental symptoms. There may be now that there is a lot of fear, there is so much of tension and stigma, everything which is available. So even arsenicum album would cover mental symptoms such as fear of disease, fear of death, and etc. So hence, probably it was considered as a prophylactic remedy for COVID-19. Now we have seen that, to summarize, to show that where the homeopathic medicine has evidence or how it is helping in boosting immunity. So we have studies which support the modulation of gene expressions, stimulation of macrophages, cell surface receptor action, and cytokine production when homeopathic medicines have given. And there is enough evidence of inhibition of immune response pathway and enhanced stimulation to produce natural immune cell production with homeopathic medicines. And homeopathy boosts immunity by individualized homeopathic remedies or constitutional medicine, or in any epidemics by way of genus epidemicus. We should always remember that individualized homeopathic medicine or constitutional medicine will help a lot for patients. Or when we look at epidemics, so we have a carefully selected genus epidemicus would help, or it may be we may also have selected some prophylactic remedies. See, overall, if you look at if the homeopathic medicines are used, we have a very cost-effective system which reduces the incidence and intensity, and it also reduces the mortality rates which has proven in the past evidences and experiences. Thank you. Now I'd request Dr. Salma Banu to take over.
Good afternoon, dear friends. Myself, Dr. Salma Bano, Professor and HOD, Department of Obstetrics and Gynecology, Government Unani Medical College and Hospital, Bangalore. I am very much thankful to our Honorable Vice Chancellor and the team of online training AYUSH RGHS for giving me an opportunity to present myself as a Unani consultant here. May Almighty bless us with good health and boost our immunity to fight against the COVID and emerges as winner. So as a Unani doctor, I will be presenting my case about the immunomodulators in Unani system of medicine. Pioneers of Unani system of medicine are guiding the generations to remain alert during pandemics with their profound works in classical literatures of Tibet Unani. The great pioneer Ibn Sina describes the similar situation as Nazle Wabai, contagious flu. This is mainly due to lack of manat, that is immunity, that is the body resistance to fight foreign invasions. Physiologically, hemostasis is maintained by tabiyat. This is our concept. Tabiyat is Quwwate Mudabbira Badan, that is the supernatural power in the body which regulates the body functions and maintains health and restores it whenever it is lost. Hippocrates, the father of Unani medicines, quotes that the nature heals and the physician is the only nature's assistant. Unani system emphasizes on prevention is better than cure, and Unani medicine not only helps in preventing the organism from entering the body but also increases one's immunity. The 6 essential prerequisites that is laid down by our great Unani physicians for the promotion of health and prevention of disease are: air, to keep the surroundings neat and clean with efficient good sunlight and ventilation; food and drinks, it should include 50% of vegetables, 25% of carbohydrates and 25% of proteins, and include more of nuts, sprouts, spices and salads to increase the immunity. Bodily movement and repose, one should incorporate at least 30 minutes of physical exercise daily. Sight, movement and repose, that is relaxation with daily meditation, is a requirement. Sleep and wakefulness, one should have 6 to 8 hours of sleep. Evacuation and retention, that is to maintain the excretory channels of the body to avoid accumulation of waste and toxin in the body, which are the basics of producing disease. So these are the Asbab-e-Sitta Zaruriya, as called as in Unani system of medicine, that are required for maintaining health. Coming to our topic, that is the immunomodulators in Unani, we divide our therapy into 2 forms, that is dietotherapy and then the pharmacotherapy. The first thing is the diets which boost the immunity. The first is Harirai Badam. You can prepare this Harira using 4 peeled badam, 1 walnut, seeds of cucumber, watermelon, muskmelon, poppy seeds, 1 teaspoon each, and 5 raisins. Soak in water overnight and grind to make it a smooth paste. Boil this in 1 glass of milk and consume daily early in the morning. The other thing is herbal tea to boost your immunity, that is add ginger ½ an inch, pudina 3 to 4 leaves, black pepper 3, hibiscus petals 4 to 5, cumin seeds ¼ teaspoon, fennel seed, that is soap, ¼ teaspoons. Make the decoction and drink this warm 2 to 3 times a day. Add more of your spices in your daily diet, that is the turmeric powder, the pepper, the ginger, garlic, cumin seeds, alsi seeds, fennel, and so as to improve your immunity. Now I am talking about the holy drug, that is the Nigella sativa, that is the black cumin, that is also called as Krishna Jira. It has an important place in Unani as well as in Ayurveda, and it has been mentioned even in Holy Bible. As the prophet said, the black seed is the remedy for all diseases except death. It is a potential immunomodulator. It is shown to possess wide spectrum of activities, that is, it acts as a diuretic, antihypertensive, antidiabetic, anti-cancer, immunomodulator, analgesics, antimicrobial, antihelminthic, analgesic, anti-inflammatory, spasmolytic, bronchodilator, gastroprotective, hepatoprotective, renal protective, and antioxidants. Because it has many active constituents, and among this, the thymoquinine is the most abundant constituent of the volatile oil of these black seeds, that is Nigella sativa. This can be taken in the dosage of, for children it should be 15 milligrams per kg body weight, and for adults it should be 1 to 2 grams with honey or lemon juice. In pregnancy it is not recommended because it causes uterine contractions. The prophylactic medications to boost the immunity, that is the pharmacotherapy. Make a decoction of neem, gilu, charaita, each 3 grams, filfilacea, that is black pepper, half gram, and ginger, that is dried ginger, sown 1 gram. Boil this in 100 ml of water until it turns to half. It should be given empty, so that is early in the morning, and if necessary you can add 1 teaspoon of honey. The other decoction is, it is called as Nazle Har in Unani, that is, and it is also recommended by Ministry of AYUSH, that is Behdana, CCRM has recommended this, Behdana, Unnab, Sapistan. We have to make a decoction with 200 ml of water, add hoxie seeds and to this decoction and give it to the patient along with 30 ml of Sharbate Banafsha twice daily. Now I am speaking about the miracle drug in Unani, that is a prophylaxis, a must prophylaxis in the prevention of epidemic. It is a blend of Satya Ajwain, Satya Pudina, Satya Kafur. Its application is take 2 to 3 drops with honey or warm water twice a day for 5 days. It usually improves your immunity. And it can also be taken externally, that is blend this with handkerchief, mask or tissue paper and inhale it frequently. And also 1 or 2 drops can be incorporated in warm water, and gargling can be done early in the morning and 2 to 3 times the whole day. Research shows that essential oils raise chemical markers in the body indicating positive stimulation in the immune system, provide dual protective effect by increasing strength and efficiency of the immune system and limiting ability of the viruses to replicate. These essential oils from many plant families have demonstrated antiviral properties in laboratory and real world settings. Interestingly, different plant families exhibit various degrees of effectiveness depending on the virus strain. This is due to particular molecular structures found in each type of oil which penetrates physical entities to varying degrees. Many of the abstracts and PubMed, the database of the National Institute of Health, and reviewed journals articles describe essential oils activity as an excellent preventive measure. Envelope viruses are most sensitive to essential oils with a high amount of monoterpene alcohols. Influenza viruses are enveloped viruses. One of the reasons for oils effectiveness in vivo is their lipophilic character. So, dear friend, this Archaic, that is the miracle drug, has been given during the swine flu outbreak by our college to general public, and it has been given in the colleges and the schools and to the government officers, and we had a very good response of this drug during swine flu. And some of the other compound formulation for boosting immunity in Unani system of medicine are Tiriaca samania 1 gram twice daily for a week, Khamire marwari 5 grams twice daily for a week, Khamire abrasham Hakim Arshadwala 5 grams twice daily for a week, Tiriaca arba 1 gram twice daily for a week, Sharbate unnab, even this is advocated and guided by CCRM, 10 ml twice daily for a week, Tiriaca wabai 1 gram twice daily for a week. Thank you for your listening, and take home message is stay home and save India.
Good afternoon. I am Dr. M.K. Sudarshan. I am in some 3 COVID K committees of Government of Karnataka. So, as Vice Chancellor is not in his office now, I have been requested to moderate this question and answer session. I think we'll take up the questions in the chat box. How disease spreads through an asymptomatic person or patient, it is the same respiratory droplet infection is the current epidemiological information. Next is presence of all symptoms mandatory or even a single symptom to be in COVID-19. I refer it to pulmonologists. Yeah.
Even a single symptom should be considered. As of the present situation, any single symptom also to be considered as COVID.
Yeah.
Suspect.
Yeah. Thank you. The next question is, all AYUSH doctors' services should be used with immediate effect and not waste time anymore as it is already getting late. So far, only data is being taken by officials and no utility seen. So anyway, you see, government of Karnataka is working 24/7. I am telling you with all honesty. I am not from the government system, but I have seen how it is working in the last 2 months. And whenever there is a need to increase the level of participation of all systems, government will take the call. And as of now, whatever is the state guidelines, I think let us follow it and let us honestly implement it also. Next is just wanted to know about the possible hemodynamical changes in completely recovered patients. I refer it to Dr.
Yeah, as per our cases, what we have seen is hemodynamically mild cases or even a severe cases. The blood reports follow up at the end of discharge time. We have not done routine blood investigation, which we are supposed to do because of clinical symptom. We are given more important to the clinical symptoms and the swab report. So that turned out to be negative. Most of them are hemodynamically stable at the time of discharge.
Next question is, along with modern treatment protocol, I think modern treatment protocol, I understand it is allopathy. Do you feel AYUSH immunomodulatory drugs can be used in the present condition?
Because we are increasing the immunity to fight against the disease,
Yeah.
it can be incorporated, sir.
No, you see, I will tell you, for it to be incorporated, there are certain issues. Like, first a national guideline has to be given. And then who will administer to these patients who are presently in the allopathy hospitals? It cannot be given by the allopathy doctors. So the presence of a qualified AYUSH doctor, for him or her to administer the government approved AYUSH medicine, it requires a direction or a guideline. So pending such issue of guidelines, in the current circumstances, they are treated as per the current national guidelines, which is coming from Government of India. That's all. Any others?
Look into those mild and moderate cases which doctor had mentioned in his presentation. And if I remember right, he had told the use of hydrochloroquine as a prophylactic measure, which at home only it is dispensed. Probably those patients who are having mild and moderate along with these medicines can also consider using the AYUSH system of immunity boosters. We are not calling it as medicines now. To boost your immunity along with that, definitely they can consider it.
No, as of now, mild cases are being admitted to the hospital. Only thing is what we are finding difficult is, there is a fear among doctors who are seeing COVID-19 patients. Nobody is getting inside. So that is the biggest fear. So getting inside, wearing that PPE kit is the most difficult thing one is experiencing. It is easy to talk, but once you are in there, somebody's doctor's shoes who's treating or who getting in is very difficult situation.
even if you wear N95 mask, after 3 to 4 hours, you will feel suffocated. Anyway, now this immune booster, which is also recommended by our Honorable Prime Minister, even today in his morning 10 o'clock message he has given, I recommend that these immune boosters should be taken by persons like me who belong to high risk or vulnerable to COVID infection. I think let us use this opportunity and take the benefit of AYUSH system. I think that's my professional recommendation. If it is okay with all of you. Yeah, thank you. Yeah, thank you. Thank you.